Well, the first case of the Omicron variant has now been identified in the U.S. So here to answer your questions is Dr. Daniel Kiritzkis, Chief of Infectious Diseases at Brigham and Women's Hospital. Thank you so much for being with us.
It's a pleasure to be with you, Jessica and Ben.
All right, Dr. Kiritzkis, let's talk about what we know, which frankly is not very much. We do know this patient flew from South Africa to San Francisco on November 22nd, tested positive a week later, November 29th, so just this past Monday. Health officials have identified all close contacts. So far, everybody has tested negative. The public health threat does seem contained, perhaps, but I'm sure there are other cases here. What do you think?
Oh, I think that's exactly right. I mean, this is one particular case, and it's great that this person reported his travel history, that they were able to identify the contacts, and most importantly, that nobody else became infected. But I think we would be fooling ourselves to think this is the only introduction of Omicron into the United States, and there almost certainly are other cases out there somewhere.
Yeah, I got to ask you this, too, because we do also know the patient was fully vaccinated against COVID, but did not get a booster shot. Is that significant? And does it suggest to you that Omicron can evade the vaccines?
Well, it's hard to know. You know, we've certainly seen plenty of breakthrough cases with Delta here in the United States, and the vaccines are not going to be perfectly protective. Whether there's relatively more or less protection against Omicron compared to Delta or Beta or the other variants is too early to say. But the fact that this was a breakthrough case by itself does not really tell us very much.
All right, President Biden has said that the Omicron variant is a cause for concern, but not a reason to panic. And I've seen a couple of articles out there in recent days, including one this morning in the Telegraph of London that said there could be a silver lining here. If Omicron is more transmissible than Delta, but is less severe, that could actually be a way this pandemic ends. What are your thoughts on that? Obviously, there's a lot more that you, I would imagine, still want to know about this.
Yeah, well, first of all, I think there's almost never a reason to panic. So I think it's much more appropriate to be concerned than to panic. I think that we don't know whether if this virus is in fact less virulent, causes less severe disease, it would induce the same level of protection as other more dangerous versions of coronavirus. So I would not rely on the spread of natural infection to generate herd immunity. There really are no examples of viruses where herd immunity leads to protection of a population. Think of all the generations that we had smallpox and measles, and we never developed herd immunity. It was only when we had vaccines and everybody got vaccinated that we eradicated those infections.
Okay, I got to ask you also about this new study, this one looking at people who experience breakthrough infections. Does it say anything about their ability to spread COVID to others, in your opinion?
Well, this is a really very interesting report, actually, from colleagues of mine at the Harvard School of Public Health and at the Brigham and Women's Hospital. What they showed is that people who were vaccinated and had a breakthrough infection shed virus for several days shorter than unvaccinated people. That doesn't mean that they couldn't transmit during the time that they're shedding, but they would be infectious for a shorter period of time. That's good news. It's a projection because they didn't actually measure how many contacts became infected. They're projecting based on what they know about the clearance of virus from these people that they would be infectious for a shorter period of time.
All right, Dr. Daniel Kiritzkis, a lot to cover tonight. Chief of Infectious Diseases at the Brigham. Thanks so much for your time, Dr. Kiritzkis.
You're very welcome.